There are now many therapists offering therapy through Skype. Using Skype for therapy is becoming very popular indeed. Many people prefer having their therapy sessions on Skype simply because it's more convenient. It means you don't have to leave home. But another advantage of using Skype for therapy sessions is that it's much more comfortable for you. It's much less intimidating for the client. It's less clinical in nature. And I believe this is a very important advance in psychotherapy, to make it less clinical and more available as an educational type service to help you learn the strategies that you need to work with difficult emotions, to learn practical methods for overcoming anxiety, for example, and managing panic attacks. Many of my online therapy clients suffer from anxiety. That's perhaps the most common condition that I treat using mindfulness therapy, and they all really enjoy this approach. Many of my clients have already tried conventional in-person therapy sessions with a counselor or psychotherapist, using the more traditional talk therapy approach. And many have also been prescribed medications to treat their anxiety or depression. What I find over and over again is that simple talk therapy or counseling and medications are just not enough. They simply do not treat the underlying cause of your anxiety or depression or addiction. They may treat the symptoms, they may make you feel better for a while, but the results won't last because nothing has changed at the underlying psychological level. And this is where mindfulness therapy comes in. This is a technique and an approach to psychotherapy that I developed many years ago now, and that I talk about in my book, The Path of Mindfulness Meditation. Mindfulness therapy is, of course, based on some Buddhist psychology, but you don't need to be a Buddhist to practice mindfulness, far from it. What mindfulness really teaches you is a way of developing a conscious relationship with your mind, with your emotions, with your thoughts, with your memories, with your perceptions, with your beliefs, with anything that constitutes mind. For most of us, we do not have a conscious relationship with our mind. Our mind simply operates out of blind habit, out of blind conditioning. For example, we may have a particular thought about taking an exam, or a thought about driving, for example, to a new place, and then experience tremendous anxiety or even a panic attack. The thought, of course, is not the cause of the anxiety, but it is a trigger. And what it triggers is an underlying psychological conditioned reaction. And that's what we focus on changing during these mindfulness therapy sessions that I offer over Skype. We have to change these emotional habits directly, talking about them or treating them, the symptoms with Medicines will not change that underlying emotional habit. So learning to form a relationship that's based on consciousness and a quality of friendliness even with your emotions is absolutely central to produce lasting change. That's the first step in mindfulness therapy. It's developing freedom in relationship to your emotions. Learning how to have a conscious relationship with your emotions without becoming reactive, without becoming overwhelmed by that emotion. And this is very possible with training, and most of my clients are able to do this quite successfully after 2 to 3 sessions. So the anxiety may get triggered, but they no longer react with anxiety. They no longer become identified with that anxiety. This then makes it very much easier to change that habit directly. If you're not feeding the habit through reactivity, then the habit has no choice but to change. And changing the emotional habits is another stage in mindfulness therapy that we start to get involved with perhaps after the first or second session. And this is where we explore the imagery of the emotion. All emotions are based around imagery. That is, how you see the emotion in the mind. It's how you see it that determines the intensity of the emotion. And this is very clear, of course, in the case of traumatic memories. It's not the event itself that creates the emotional trauma. It's not the memory of the event that causes the emotional trauma. It's the way you see that memory in your mind. And of course, for a traumatic image memory, it's likely to be very intense in color, likely to be very close psychologically. You see the image very close, likely to be very large, and many other factors like that. That's what actually causes the emotion, not the event, not the objective memory of the event, but the subjective way we see it in the mind. And so this is the second phase of mindfulness therapy that we investigate in great detail during the second or third session. We start to investigate the actual structural imagery of your emotions. The more you see, of course, the more you can change that imagery. When you change the imagery of an emotion, you change the emotion itself. You change the cause of that emotion. So this is quite an interesting area for most people. Most people have never looked at the imagery of their emotions. But this is the actual mechanism that produces emotional suffering, that produces anxiety, that produces depression. It's the imagery. So during the process of mindfulness therapy online, we will begin to develop both of these aspects for changing those emotional habits directly. The first, changing your relationship to the emotion so you don't feed it through reactivity. Second, explore the imagery of the emotion and change that in a way that leads to the reduction of the intensity of the emotion. This is the most direct method that I know of to successfully overcome anxiety and depression, and also for treating PTSD, of course, and other forms of traumatic experience which leave these intense images in the mind. If you are interested in talking to me more about using Skype for therapy sessions, do please go to my website and contact me through email. I will answer all your questions and we can schedule a Skype therapy session when you feel ready. So please go to my website and contact me now. Thank you.